Hi, everybody. This is Gayle Dahlman, and thank you so much for joining us for this webinar today. I want to just a couple of housekeeping notes first. Your phone should be on mute. You're not going to be able to talk during the webinar, but if you have a question, please type it in the Q&A section of the webinar desktop. It's on your right-hand side. I am going to do my best. This is a half-hour webinar. I'm going to do my best to answer all the questions as we go, but if we run out of time, there will be an email at the end of the session that you can email your questions to, and we'll get them all answered. So when we get started, I am the Certification Director for the Convention Industry Council. I head up the CMP certification program that you're all familiar with, but I'm also working with a lot of wonderful subject matter experts to create the new subspecialty of the CMP, the CMP-HC, which stands for healthcare. Today with me is Agnes Canonica. I'm sorry, Agnes.
That's okay, Gayle. Agnes Canonica from MD Events.
Thank you. Agnes was one of the subject matter experts we recruited when we started this whole process. She'll talk a little bit more about her participation as we get through the program. So thanks for joining us, Agnes. Okay, so I'm going to begin now. I can hear people are still joining us, but like I said, we only have a half an hour. So the CMP-HC is a certified meeting professional, and specifically for people who have to plan healthcare or life sciences related meetings. We wanted to show that by naming it this, that it has a connection to the CMP. It also improves the brand of the CMP for you guys who have this designation, but it also reinforces that you can't have one without the other. Okay. So what is it? This is a healthcare subspecialty for healthcare meeting professionals. It was designed to test knowledge specific to this unique industry. You guys know that there are many, many things you need to know above and beyond what you've proven you've known in the CMP exam that you need to know to manage healthcare-related meetings. So this is for you folks that are already working in this field, and it also does not repeat any knowledge that's already been tested on the CMP. I'm going to pass the microphone over to Agnes now.
Okay, thank you, Gayle. Good afternoon, everyone. It's a pleasure to be part of this call. This is definitely something that I was extremely interested and passionate about. What a wonderful way to finally validate our skill set in the industry. So the slide here is why should you? Why should you get your sub-certification? So the first two bullets kind of go hand in hand in terms of validating your knowledge and recognizes your industry expertise. That demonstrates that you take your career in the industry very seriously and that you're fully qualified to work on all kinds of different healthcare meeting management programs. From a competitive advantage with career development, this certification also will provide a higher level of interest by prospective employers, therefore giving you the competitive advantage in terms of staying in the healthcare meeting management field. From a salary leverage, this is viewed as an education investment, and that it definitely has a tangible value versus a candidate that may not have this certification. And in terms of credibility, where you might be prospecting for new business when you're on the agency or the vendor side, it really demonstrates in-depth knowledge of your understanding of the industry, and in order to service the clients accordingly and within regulations and compliance, and when you're pursuing new opportunities, that will just demonstrate that you are fully knowledgeable of what the healthcare meeting management industry entails, and therefore should definitely provide additional opportunities for you. So Gayle, on that point, I will give it back to you.
Okay, thank you. Thank you, Agnes. So Our goals, as Ines was talking about, is to identify professionals who have this knowledge and to recognize that this is a very specific knowledge you must have. Just going through the process of creating this certification, I was just amazed at what you all need to know in order to follow regulations and policies and make sure that your meetings go smoothly, and you need a special knowledge for that, as you know. So what are the requirements? You're going to be so happy. Most of you, I assume, got your CMP when we had all those points that you had to accumulate. No points are going to be required for this one. A little while ago, the CMP program moved to a combination of experience and education only, and that is going to be true for the HC too. So no points. I know I can hear you all going, yay. So first, you must hold a CMP. I see that one of you have already asked that question. You can hold a CMM, but it's not an eligibility requirement. You must also have 3 years, 36 months of experience in the healthcare meeting management field. This is the same as the CMP. You also must have 15 clock hours of professional development that's specifically related to healthcare meeting management. We are finding as we get applications in that this is probably the most difficult thing to accumulate. So there isn't a lot of education out there. You get it. I can tell you by the subject matter experts who work with us that there are things out there. They're just not as easy to find as, say, continuing education for meeting managers. I have listed, I have a list. If you would like it, I will send you a list. I don't post this on our CIC website because we don't want to give the impression that we have vetted any of these these continuing education providers. But I had asked everybody who has worked as a volunteer on this to provide information on where they get their training, where do they go to get more information to stay current in this field. So I have compiled this list, and by all means, you can email us at the end, or I'll send it to everybody. Okay, that I just so to cut down on all the emails I'm sure you're all getting, I will send that to everybody at the end of the meeting. So those are the qualifications. The cost involved in this is they're similar to the CMP in that you have to apply and you send in your application with a $155 application fee. If you are approved, you then send in. We will send you information on how to register for the exam, and at that time, your examination registration fee is $255. Now, for the people who are taking the beta exam, which I will talk about in a little bit more detail in a couple of minutes, we are waiving the application fee. This is for two reasons. We want to thank you for sitting for the beta exam, and then we also know that it'll take longer for us to get the results back to you because we have to do a complete analysis of the exam's performance after the beta exam is complete. So as another thank you for waiting for your results, we've waived that fee. The certification process is the same as the CMP if you have gone through it since the point process. So you send an application with your fee. If you're approved, you get a information on how to apply to register for the exam. You sit for the exam. If you pass the exam, you then hold the designation of CMP-HC. Oftentimes when certification programs provide beta tests, they don't allow you to, if you pass, to get the designation. But CIC decided that we are going to, in fact, give the designation to anybody who passes the exam, and these will be the first people first inaugural class to hold the new certification. We, again, for those folks who got their CMP a little while ago, you had to go someplace. You had to, there was like 1 or 2 testing places a year. You had to go travel to them, sit and take the exam. Not so anymore. For those of you who have taken it in the last few years, you know that you can take it during one of 4 testing windows, and you can take it at a Prometric test site on a computer at test sites throughout the country and throughout the world. To start the CMP-HC exam, we are going to offer it only twice a year to begin with, and then as the program grows in popularity, we will add testing windows to that. Okay? You're going to ask how to prepare for this, and I'm going to tell you again that there isn't a lot of stuff out there yet. There are a lot of information on various websites, and we have put together a list of any reference materials, any preparation materials we could find. We put up on a list on our website. It's recommended literature, and this is also the literature and the references that our item writers and our item reviewers used when they were creating the exam. How I tell people to prepare is to look at the body of knowledge, which we'll get to in a second. Decide where you want to, where you may need your most, need to study the most, and then build your study regimen based on your particular needs. The examination is going to be, like I said, at computer-based testing sites throughout the Prometric facilities. They have, I think, more than 250 test sites just in the United States and more across the world. It's going to be 2.5 hours. There's going to be 100 multiple choice questions, 85 of which are scored. And that means the other 15 we are going to, they stay in test mode until we can make sure that it's an appropriate exam and that an appropriate question and that it's performing properly, and then we will add that to the exam. The exam is situational questions designed to test your application of your knowledge. You're not going to get a lot of recall questions on this exam. How many seats do you need in an auditorium, et cetera, stuff like that. There are no CMP questions. You've already passed the CMP exam. You don't need to do that again. So I'm going to pass this back over to Agnes, and she's going to explain how the body of knowledge was created. She sat on the job analysis study, and she can go over what you're seeing on your screen now. Here you go, Agnes.
Okay, thank you very much. So I had the privilege to sit on both creating the body of knowledge and also had the opportunity to sit on the item review task force. And it was an absolutely fascinating experience. The task forces were comprised of individuals from all aspects of the healthcare backgrounds. We had people from medical device, pharmaceuticals, biotech, animal health, associations, universities. So it was, there was a big focus as well on CMEs. It was a very diverse group to represent all facets of skill knowledge that was going to need to be considered for such a certification. Very interesting process, and for those of you that once you get your HC sub-certification, hopefully you will have also the opportunity to continue to develop this exam. I would encourage anyone to do so because it is just an amazing experience of really what goes into creating these kind of certifications and the things that we really needed to consider and discuss. So in terms of medical meeting industry background, you know, pretty basic information. We also looked at the CME aspect of things. We looked at also U.S. and international regulatory guidelines and country guidelines, what it is to run an investigator meeting versus running a Congress symposia versus maybe running a biotech medical device company where you may have to use cadavers, to animal health, and what does that entail. So an absolutely fascinating process to go through, and based on being sequestered in a room for 2.5 days, this was the outcome that was accomplished to give the HC some semblance of life in terms of its due course to certification. So based on that, you know, just why I get involved, obviously I'm very passionate about this industry, and really getting involved in the healthcare meeting management sector requires such a specialized knowledge from clinical to commercial to association to congresses versus, you know, human and animal health, and most especially with all the regulatory and compliance that falls literally on the meeting manager to make recommendations on and to enforce. Hence why this HC certification is so important for anyone who works in the healthcare industry to really attain. Gayle, I don't know if you want to add anything to that. Over to you.
Thank you. Yes, and she's right. We purposely, this is a very rigorous process we do. We want to make sure that we are doing this, we are creating an exam just like the CMP that truly tests people's knowledge in this field. So I can't thank Agnes enough, and all the people. I think I've had over 40 subject matter experts who have helped us create this body of knowledge, the standards, create the items, and review them.
And just to add to that, just really quickly as a sidebar, for those of us that had the opportunity to serve on this task force, unfortunately, we will not be able to take the exam for 3 years. So we're very envious of all of you that are going to do this for the first time.
Yes, because they've been exposed to all the exams, they had to sign something that said that they couldn't take the exam until it had regenerated enough. As you know, with any certification exam, it has to keep up with the industry, and because this industry changes so fast, the items have to be constantly updated. But we figured 3 years would be enough time from them coming off of a volunteer panel to then be able to sit for the exam. So I'm going to pause here for a second. I'm showing you recertification requirements, but it's 5 years before you have to recert. So I want to answer some of the questions I'm seeing that are coming in. Yes, you have to have the CMP to take this exam. You can have the CMM certification as well, but that would be something that if you had done something to get the CMP that was CMM, that was specifically related to healthcare, you could use that as some of your 15 hours of continuing education, but it doesn't count toward your eligibility. Somebody else asked, I work for a supplier. I'm not sure if you guys can read this. Maybe you can. You can work for a supplier, and her clients are in the healthcare industry. Yes, you are eligible. Anybody who can meet the eligibility requirements, as I laid out earlier in this webinar, as long as you can meet those, you can take the test. The deadline for the beta exam I will get to, but right now we have not set a final deadline for putting applications in, because we need 100 people in order to do analysis, a correct analysis on this. Again, I will talk about that in just a couple of minutes. The 3 years experience, yes, Eric, have to be in the healthcare field. They do not have to be consecutive. You can, just like the CMP, you have to have 3 years or 36 months within the last 5 years. Okay, and that is the same as the CMP. So, like any certain, oh, I'm sorry, go ahead.
Sorry, Gayle, and I do see a question here about, do programs and conferences run by CBI qualify as professional development? And that is correct, yes. Those programs will be considered as clock hours to certify for this.
Right, right. Anything that's healthcare related, absolutely. And we are pretty stringent on your continuing education activities for the CMP exam. We are a little more lenient now, only because this is a new exam, okay? But I promise you, after the beta test, we're going to tighten that up. But for right now, we are doing the best we can to, if you have the experience and you've made an effort to get as many of the clock hours as you can toward continuing education, specifically related to healthcare, the healthcare profession, you'll be able to sit for the exam. So yes, we do have our certification requirements. They are going to be every 5 years, like the CMP. You're going to need 15 hours specifically related to the CMP body of knowledge, CMP-HC body of knowledge. After your first cycle, it'll sync up, so you don't have to remember 2 different dates on when everything is due, and that's explained more on our website too. So I don't have to get in too far here. But you can't have one without the other. Well, I'm sorry, you can't have the HC without the CMP. You can have your CMP as long as you don't lapse or expire it. But if you don't, if you lapse or expire your CMP, you will lose your HC as well. Again, because this is a subspecialty, okay? Here's the timeline. We just finished, and Ines was a part of this, was reviewing all the items that were written by a first group of item writers. We are beta testing this. We had the beta test scheduled for October 7th through the 21st, 2-week window. However, we have not gotten the 100 we need, so we're moving that date out, and we're going to increase the amount of time you have to sit for the exam. So the exam testing, the beta testing window is going to be from November 7th through December 2nd. And like I said, all the fees are going to be, fees are reduced. We are taking away we are waiving the application requirement, the application fee of $155. Once we get the beta test, what's important about this is we have to analyze the entire performance of the exam based on how people on the beta test perform. So we get yet another group of subject matter experts to review each item, see how they performed, make sure that nobody answered if everybody answered the question the same, or if everyone got it right or everyone got it wrong, for instance, it's not a good exam. It isn't testing the knowledge you need, because we need to get a mix of answers. So that's one of the things that's looked at. During the beta test exam, the beta test review, we also decide what the passing rate is based on how the exam performed. Okay, so that should take at least 2 months to complete, and then after that, we will launch it. Right now, we are hoping to launch it in May of 2014. Like I said, the Prometric test site November 7th through the 2nd, so you have about a month in which to, once you've been approved, to schedule an exam. Okay. And this is, I'm sorry, I was already talking about this, that we have to set standards, decides what the minimally qualified professional is, and then we set the passing score. So we decide, the subject matter experts decide who is considered the minimally qualified professional. And once that professional is defined, then we look at every exam question and say, would that minimally qualified person answer this question correctly or not? And then we look at the answers from there. It is very complicated. I'm probably telling you guys much more than you need to know. So I can see you have more questions, and so I'm going to try and get to answer those. The fee for the beta exam is $255. You don't need to pay that until after you've submitted your application and it's been approved. Once it's been approved, then you'll be asked to submit your registration fee. And once you do that, you'll be given a code to call Prometric with to set your exam date. if you do not pass the beta test, then do you have to pay and reapply? Yes, you would have to do that. You would have to just join the regular pack in how you go about it. So you'd have to pay the no, you wouldn't have to pay the application fee again, but you would have to pay the registration fee again, the exam registration fee. Would you like to take some of these on, Ines?
I think it's about clock. I'm seeing a lot of clock hour questions.
Yeah.
I'm not sure that that's something I can answer.
Yes, okay. Well, yes, you, again, and this is the same with the CMP, as long as you can, if you have an internal lunch, you would have to specifically show how you're learning specifically about the profession itself and not how ABCD Corporation performs these meetings. So it's a little bit different than just, I hope I'm explaining that correctly. Yes, if you have internal meetings and it's just teaching you, for instance, the regulations on the Sunshine Act, you would be able to use that as a clock hours. But if it's teaching you how to set up a meeting for ABC Corporation, you would not be able to use those. Somebody else is asking what the difference between the CMP-HC and the NCCME certification is. That certification is for folks who, if I'm understanding it correctly, offer education that is specifically related to getting CME credits. Do you know more about this, Ines?
I don't know.
Yeah, it's a little different. It is not, it doesn't teach you how, it doesn't show your knowledge in managing a healthcare meeting as much as it is asking your information on, asking your knowledge of what constitutes and doesn't constitute a CME approval. I think that's it. Don't quote me on that, please. Well, other questions? Well, I hope that we were able to convince all of you guys to come on in and take the beta exam. Everything gets pushed out a little farther until we can get those 100 people. We're hoping we don't have to do that. So I am going to send, we will send a, how long is your application good for? Meaning back when we got our CMPs, you had up to 2 years to sit for the exam. It is, now for the CMP, it is 1 year because there are 4 testing windows, and it will be 1 year, I believe, too, even for 2 testing windows, okay? That has not been decided yet. Again, we're still in the processing, the setting the processes for all these for the whole program. But my thought it'll probably be for 1 year. I do not have time working in the industry. Yes, that is very important that you would have to have the time to apply. Your experience is going to be much more important to really passing the exam too. There's nothing you can really take, no studies courses that are going to teach you how to be a meeting planner for the healthcare industry, and that is why the experience is so much more important than even the continuing education. Ines, can you answer some questions about the subject matter items contained in the tests for the Sunshine Act, for instance, if you can do it in a very general term?
Well, I did find that NDA. But yes.
Yes, very general, please.
The exam overall will address international regulations in addition to Sunshine Act regulations. Yes, they will test your knowledge on that.
Yes. Somebody had asked if any of, I hope so. Yes. Somebody asked about if there are Canadian education courses. I did forget to mention one thing that's important. PCMA has just come out with an online prep course for this. You can go to the PCMA website to get that. So anybody, no matter where you are in the world, can certainly go to the PCMA website to get 12 of your 15 hours, if that helps. And I do believe there were people on the who were Canadians who sat on our various volunteer boards, and they had given us some suggestions too. So yes, I believe there are some places you can go, and they're online as well. But we are out of time. You can see the email is cichq@conventionindustry.org. If you have more questions or I haven't answered them or you need more information, please send them to this email address. I'll be happy to answer them as soon as we can. Thank you all for your participation and for your interest. And thank you, Ines.
You're very welcome. Thank you. Bye-bye.